All right, this is part two of our genitourinary tract infections, chapter 23. We're beginning off with chlamydia, and the causative agent is a bacteria called Chlamydia trachomatis. It actually causes two diseases we'll talk about. One is chlamydia, which is the sexually transmitted infection, and the other one's called trachoma, which is an eye infection. So chlamydia is very small. It's a weird looking bacteria. It's pleomorphic, but it has a gram-negative cell wall. Pleomorphic means it just has different shapes. It is an obligate parasite, which is also very interesting. So it infects inside the cell. And because it's an obligate parasite, it's not going to be able to live outside the body for very long at all. And that means that the transmission of chlamydia is going to be direct contact, right? We can't have this bacteria living on fomites because it's the obligate intracellular parasite. So our reservoir for chlamydia is going to be our human fellows, the asymptomatic carriers, and 10% are estimated to be in the reproductive tract of people. 70% of women and 10% of men are asymptomatic. So we talked about transmission. It has to be direct contact, and in fact, breaks in the mucous membrane or skin is going to be required because it needs to get into the cells, and it does produce small painless lesions. So symptoms, as you can see here, it does mimic gonorrhea in men. So it's going to have urethritis and maybe some discharge coming from the urethra. For women, it's called cervicitis. So there's some inflammation of the cervix with white drainage. So you can actually see the picture here. I'm sorry, it's pretty gruesome, but this is, what the OBGYN would see. So the vaginal wall is what you see surrounding this area is the cervix. So this is the entranceway into the uterus. And then this is the discharge. You can also see the cervix is very, very red. The infertility is the same as what happens in gonorrhea, so with PID, and the treatment is with antibiotics. In fact, a lot of times if there's gonorrhea, there might also be a chlamydia infection. For chronic chlamydia, chlamydia can move up sort of the lymphatic system, and it can infect the lymph nodes that are around the genital region. So those are called inguinal lymph nodes. And if the strain is particularly virulent enough, right, the body doesn't have a chance to remove it, and it becomes a chronic infection long term. And this is, again, without treatment. So the lymph nodes begin to fill with cells. The lymph nodes are going to be areas of your body that have high concentrations of white blood cells, and they are plentiful in the body. They're really plentiful in the inguinal region. And so when these get swollen with cells, they become like a hard nodule, and that's called lymphogranuloma venereum. So the granuloma is kind of the same word we used for those tubercles that filled the lungs in tuberculosis. They're swollen. They're cell-filled lymph nodes, and what they can do is obstruct the normal flow of lymph. So you can get extra, basically fluid buildup in the lower extremities, in the inguinal region. They become very firm and tender. And one thing that will come up later when we talk about the plague is that these really large, swollen, tender lymph nodes are called buboes, and these buboes can burst and the pus can go through the skin. Male genitals can become enlarged because of that drainage. It's just like the lymphatic tissue fluid cannot be removed from that organ, or like the extremities, and normally that fluid would move back to the bloodstream by the lymphatic system, but if you block that flow, it stays in the tissue and just becomes really swollen. So long-term lymph obstruction can lead to chronic and deforming edema of the genitals and the anus. And so this is what we call lymphogranuloma venereum. As you can see, the very swollen lymph nodes. This is syphilis. Syphilis is the spirochete, the only spirochete we're going to talk about, actually. So it's a curvaceous bacteria, kind of like a wine opener. It's a gram-negative spirochete. And the reservoir is found in humans and in animals. So in our mouths sometimes, intestinal tract, perigenital regions, and it is another strict parasite. So we know that it has to be passed on by direct contact. And if there's broken mucous membrane, that's where the bacteria is going to attach to. It does require, it does require live cells for cultivation. So transmission, direct contact with mucous membrane or broken skin, and not many bacteria need to, form an infection. So this is very low ID50. Once inside the body, right, it has a little hook. If you see, I think the hook is over here. It hooks onto your mucous membranes and starts to replicate. And then as it replicates in your body, it does move into the bloodstream. So if you let it go, right, there's 3 stages of syphilis. And the question here is like, are treponemes going to be able to live outside the body? No. And what does this mean about transmission? That it has to be direct, right? So skin to skin, mucous membrane to mucous membrane. So this is what primary syphilis looks like. So primary syphilis at the point of inoculation, so where the bacteria got in, you're going to have a lesion, and it can be anywhere where the bacteria got in, on the cervix, the penis, the anus, within, 10 days to 3 months of transmission. These lesions are going to have a lot of bacteria dividing in there, and they're very, very infectious. The lesion is called a canker, and despite what it looks like, it's painless. So a lot of people just miss having a canker because if it's in an area of the body that you don't check very often, it's not visible. When you look at yourself in the mirror, then it can be missed. So it's a hard and painless sore. It can turn into an ulcerated sore. And one of the things about a canker is you can see that this area here is raised and it has this depressed part in the center that is typical of syphilis cankers. The fluid is highly contagious, obviously, because all those cells are dividing in that spot. So this little guy, this area here just says that it's, painless. Sometimes people miss it. And then the canker actually spontaneously heals as the spirochete moves into the blood and starts to really take hold of the whole body. So that's primary syphilis. Secondary syphilis is when the spirochete is actually multiplying in the bloodstream. So that's sepsis. The rash on the skin is particularly the palms and the soles of the feet are very unique. Many times rashes on the body manifest just on the sort of thin skin that we have, but these secondary syphilis can appear on the palms and the soles of the feet. So we have a rash, right? This is a hallmark of our secondary syphilis. You're also going to have general illness, right? So malaise is just being tired. You have a fever, swelling of lymph nodes, and you're also very highly contagious in the second stage. And this can last, weeks, 2 to 6 weeks, and is recurrent in about 25% of cases. So that means you can have secondary syphilis several times. Okay, so after the secondary phase, what happens is the syphilis kind of goes dark. So it enters a latent phase, which there are no symptoms, but you still can test for, and you will, test for positive the syphilis is in your body. So the latent phase can last for years. And the major complications that occur with tertiary syphilis would be that the bacteria has really gone to work on your bones, the joints, the liver, your brain, the eyes, and this can cause really long-term complications. So tertiary syphilis, not everybody gets it, right? So it goes latent, and then 30% of people, the latency will start to show, you'll have that tertiary form where you'll start to see the damage done to our internal organs. Sometimes that latent period can last 20 years or longer. So there's a couple of things here. One hallmark of tertiary syphilis is a guma, and a guma is basically either a mucous membrane, a bone, or organ ulcer. They're basically small rubbery tumors with necrotic centers. So we know that necrosis means cell death. And if you have this in your internal organs, that's very serious. It's usually just contains a mass of dead and swollen fiber-like tissue. So we can see a guma in this person's skin. And obviously it can be fatal if it's causing issues in your heart, brain, important organs. There's actually several forms of tertiary syphilis. Another one is called neurosyphilis. So it can, the treponema has some kind of affinity for the nervous system, and it likes the blood vessels in the brain and the cranial nerves. So neurosyphilis is a possibility. Not everyone with untreated syphilis will get neurosyphilis, but neurosyphilis can cause neurological symptoms depending on where the bacteria is. So in the brain, it can cause dementia, depression, irritability, headache, mental confusion. If it's in your motor neurons, it can cause muscle weakness, incontinence, reflexes are abnormal, walking, a stiff neck, and blindness. So anywhere in the central nervous system or peripheral nervous system that it sort of forms a problem with, right, you have the symptoms. And so this is just a flow chart of infection. So we have our infection with Treponema pallidum, right? We know that it grows at the site of infection, and we're going to have a canker, right? So that's our first sign that we have primary syphilis, a canker at the site of infection. And sometimes you have this lymphadenopathy. Basically, the lymph nodes are involved here. Secondary syphilis, disseminated rash, right? And we have generalized ill feeling, illness feelings, fever. And then we have our latent stage. The latent stage is going to be where it hides, right, for 20 years or longer. In this phase, you can have a recurrence of the secondary syphilis. You can have a rash again. And then from that point on, most people just don't have any further complications with this bacteria. And then we said about 30% get the tertiary form of the syphilis, where we have the guma, and we talked about the neurological symptoms. And we also know that the heart can be a target of this bacteria. So one thing about syphilis is that it does cross the placenta. The two other sexually transmitted infections so far, gonorrhea and chlamydia, they do not pass through the placenta. So they are passed on to the baby through the birth canal. This is different. Syphilis can cross the placenta while the fetus is actually still inside and still developing. And it can disrupt any of the trimesters. So it can go in any of the trimesters if the woman has syphilis in her blood. And it can disrupt development. And it's really sort of very severe birth defects can arise from this. So we can see symptoms can range from mild to severe. Miscarriages and stillbirths are possible. They can have, just like our own bodies, they can have lesions in the skin. They can have bone deformity and also nervous system abnormalities. These are some other things that can form. They overlap with an adult syphilis, right? Neurosyphilis, blindness, cardiovascular lesions. And because the congenital syphilis is such a risk, everybody is screened for syphilis. When you're pregnant, if you have healthcare, if you can make it to the doctor, you're screened. One interesting hallmark that syphilis causes, or this congenital form of syphilis, is Hutchinson's teeth. So you have this rounded look to the two front teeth. All right, so we're finishing up the bacteria. We covered vaginosis, we covered chlamydia, we covered gonorrhea, and we covered syphilis. We're moving on to viral infections now. So we have two viruses to speak of, herpes and human papilloma. Herpes viruses, there's two herpes viruses, herpes simplex virus 1 and 2. They are both going to be associated with kind of a lesion, a blister, and the type 1 is most associated with oral lesions like cold sores or fever blisters, and the type 2 form of the virus is most associated with genital herpes. However, it doesn't matter. The virus doesn't care. So you can definitely get infection with either type in either location. You can get herpes 1 in the genital area. You can get herpes 2 in the oral region. So it's not, it's not 100% that if you have cold sores, it's herpes type 1, it could be herpes type 2. Many people who have the HSV virus in them do not develop symptoms. They're mostly asymptomatic. In those people that do have symptoms, they can get this general sort of infection, right? Fever, chills, malaise, swollen lymph nodes, and then the vesicles that are made are going to be painful, and they do have fluid in them. They're fluid-filled vesicles. When these burst, we can think that obviously there's going to be lots and lots of viral particles in that fluid, so it's very transmissible in those vesicles. HSV2 can experience reactivations. HSV is both of them. Okay, 1 and 2, you can get reactivated. And the reactivation occurs differently for different people, but sometimes stressful conditions, being sick can reactivate the virus, and you can get an outbreak, right? So we know that herpes, if you get cold sores, you can get cold sores every once in a while. Usually people know that if they get sick, they might get a cold sore. If they're under a lot of stress, they might get a cold sore. The same thing with genital herpes. So genital herpes can reactivate in the same manner. So here's the sort of look at male herpes lesions typically develop on the penis with a watery discharge, as we can see. And for females, it's on the vulva. But so that's the outer part of the female anatomy that you can see with your eyes, but they can also develop inside the vagina and in the cervix, which is invisible to the eye because you need to basically look inside. The symptoms are usually mild, but they can be very irritating, and it can be accompanied by urinary distress or discomfort. So this is what, on the skin, the herpes lesions look like. So for treatment, there's no cure or vaccine for herpes viruses. All herpes viruses, we talked about chickenpox, they are always latent. That's the thing about herpes viruses, is that there's no cure, and right now there's no vaccine for these infections. So what's used to treat these viruses is antiviral medications, and this basically helps keep people from it basically reduces the breakouts, reduces the signs and symptoms, and tries to keep the virus in dormancy. If the medication is stopped, then your herpes virus will just go unchecked, and it'll just kind of resume its original severity. And the recommendation is to take the medicine every day and at any start of an outbreak. So here's neonatal herpes. Neonatal herpes is transmitted to the child during childbirth, and the child's exposed to the virus in the birth canal. And the thing about herpes is that even though you might not have the sore, a visible sore or a vesicle, the virus can be under the skin, and you can still infect someone even though there's no lesion. So infections can occur whether lesions are there or not. And in most cases, it's limited to the skin, the mucous membranes, and eyes, and outcomes are relatively good. There's always a chance it can reach the central nervous system, and that's really bad for the baby, resulting in motor function deficits or death. All right, so moving on to another topic, genital warts, and this is caused by human papillomavirus. Okay, so the herpes, these are not warts. These are going to be pustules or vesicles filled with watery substance. Warts are going to be dry, and they're just overgrowths of the skin. There are many, many types of viruses that can cause warts. And there's a lot of variety of the strains of human papillomavirus. It is a very common sexually transmitted infection to have genital herpes, and certain strains of, sorry, I said herpes, warts can be caused by certain strains of the human papillomavirus. So we can see there's 200 different strains of HPV, 40 causing the sexually transmitted infections. So genital warts, can be asymptomatic and self-limiting. So, which is good news, right? So you can get infected with HPV, have a wart or not, right? And your body can clear this virus, and you will never have, another sign of that virus. Some forms of HPV, and these are not the same that are associated with genital warts, which is interesting because I actually thought that the ones that cause genital warts were also the ones that cause cancer, but it's not so. So, some forms of HPV can cause cervical cancers, and there's 14 oncogenic. So the word oncogenic means cancer causing that can that are linked to cervical cancers. So a causal association is a very firm association with the cervical cancers. And we have few types that are extremely oncogenic, associated with 70% of cervical cancers. They can also cause oropharyngeal cancer. So this is going to be the throat and mouth. They can also cause anal cancer, vaginal cancer, vulval cancer, and penile cancer. So it's not limited to just the cervix. So treatment for genital warts, most resolve spontaneously, which is great news, right? That means you're a healthy person, can basically resolve the virus infection. But if you needed therapy, there are medications to remove warts. There's medications that stimulate interferon production. Remember, interferon was our body's innate response to viral infection. A cell that is infected with virus will secrete interferons, and that will tell the other neighboring cells that there's a virus nearby and we need to set up an antiviral stance. There's also cryotherapy, which is freezing the warts, electrocauterization, and carbon dioxide laser therapy. Of course, the best prevention for any viruses, any viral infection, is going to be to get vaccinated. And the Gardasil vaccine includes type 611. We don't have to remember the types, but the types that are included in that vaccine, there are 4, and they're going to cover the most prevalent types that cause the cancer. So can you get cervical cancer and also, having gotten the vaccine? Yes, but it's going to protect you from, 90% of all those strains. Oh, sorry. So I misspoke. There's 4 here that are caused with, that are, 90% of genital warts infections are caused by these 4. And then it also vaccinates against some other forms. So there's actually 9 strains of the virus in Gardasil. Because it works as a preventative, right? You're giving your body those memory cells. It's really recommended for people who are not yet sexually active. So for children between the ages of 9 and 15. So the efficacy of Gardasil is quite good. You can see here that we've really decreased the possibility of cancers and breakouts from HPV by 80%. And this is from 2008 to 2022. So that's really phenomenal numbers right there. So it's a great vaccine. All right, so our viral infections are going to, we have our cervical cancer, which is our HPV, genital herpes, human papilloma warts, and then we had our neonatal herpes. This is going to be, okay, now we're starting the yeast. I thought I had a title page for yeast, but this is our yeast beginnings. So what we have here is a slide of an epithelial cell, and on the cell there are lactobacilli. Okay, lactobacilli are gram-positive rods, and they live as normal flora in the vagina and in mucous membranes. And then this one is a picture of what Candida albicans would look like if it were in the body. So we know that Candida is a yeast. So a yeast is a round cell like this. And when it grows inside the body, it will sometimes form these pseudohypha. So it's not a true hypha, like those blockish cells that fungi will make, but they're going to be strand-like and look like hypha, but they're not technically a hypha. But that's what you would see if you saw Candida prepared with KOH there. So our yeast infections, our first microbe is going to be Candida albicans. As you all know, it's part of our normal flora. So it can exist as a yeast form or as a multicellular in those pseudohypha that we just saw. Normal flora of our skin, as well as our gastrointestinal tract, as well as our respiratory system and our mouth and nose, as well as the female urogenital tract. So definitely in the vagina. And it typically, right, the issue with Candida typically falls to women in the vagina, in the reproductive tract. And Candida is the most common cause of overgrowth of the yeast, which is going to be called fungal vaginitis. So now we have an itis, right? We have an inflammation of the tissue in the vagina. So what causes the overgrowth of the yeast in the vagina? And usually it's some kind of shift in the normal flora or some kind of shift in the pH. So if you are on antibiotics, so a lot of women, if they're on long-term antibiotics, like 2 weeks or so, or even sometimes 1 week, the antibiotic is systemic. So that pill you're taking is going to go all through your body in the bloodstream, and it's going to kill off not only the bacteria it's supposed to be targeting, but it's also going to kill off your normal flora. So in the vagina, there's this balance between bacteria and fungi. If the bacteria levels go down, then the fungal levels can go up, and that causes your yeast infection. Illnesses can also be a cause of chronic yeast infections, especially diabetes. So diabetes, you guys, there's extra sugar in your bloodstream, and the yeast love that. So the yeast will feed off of that sugar and overgrow. Pregnancy, for women who are pregnant, you are considered immunosuppressed. And you also have very large hormone shifts, and those can both cause an imbalance of the environment. Immunosuppression is a big cause of Candida infection. Part of the reason why things are in check, right, the yeast and bacteria, is not just that they're competing with themselves, but also the immune system helps keep it down. So if one of them starts to overgrow, your immune system can start to put it back into homeostasis. And so when you're immunocompromised, you're very easily susceptible to yeast infections. So yeast infections are really common with those with HIV that cause Candida to thrive. A lot of HIV patients will get thrush, which is the yeast infection in the mouth. So when the yeast infection develops, we do have inflammation, as we talked about in vaginitis. And we have itching, thick white or yellow discharge, and odor. And here again is the cervix. That is, you have that white growth, that's the yeast there. Treatment is quite simple, over-the-counter treatment with antifungal suppositories, or if needed, oral medications. Now, going through this chapter while I was making it, I was like, oh, maybe some of our friends out there don't know what a pap smear is. So a pap smear is, or these procedures for women, the OBGYN would take a speculum, which is this metal device, and it basically opens the vaginal canal so that the doctor can see inside, and we can take a look at the cervix. So those are the two pictures we saw. Unfortunately, they were not healthy cervixes. They were unhealthy, but the lining of the cervix is going to be swabbed with kind of a brush. And you can see that we're kind of getting into the opening to the uterus. And we take a sample of the cells here, and then it's later used to look under the microscope with, so a microscopy examination. It can also be sent off for other testing. All right, another cervix that's unhealthy. Sorry, guys. This is our trichomonas or vaginalis. This is the protist. So now we're on to the protist. Trichomonas vaginalis is going to be a protozoan. It's flagellated. We looked at this guy in lab. The disease is called trichomoniasis. It's oftentimes abbreviated TRIC. And it is only a trophozoite. A lot of our protozoans out there can form a dormant form, right? That's called a cyst. And then the active metabolizing form is called the trophozoite. Trophozoites are going to be much more susceptible to the environment, to dying from, the changes of the environment, or to digestion. Cysts are much more hardy. Most of the time, we get infected with protozoans with their cyst form, but not so with Trichomonas vaginalis. So it only exists as a trophozoite, meaning that it's not going to be able to exist very long outside the body. So again, transmission has to be direct contact. So once the protozoan gets into the body or mucous membrane, it can actually eat the other microbes. It phagocytoses other microbes, and it can cause a normal microbiota to change, develop an imbalance, but the imbalance is actually favorable for the Trichomonas protist. So for males and females, males are generally asymptomatic. If they do have symptoms, they're very similar to urethritis, right? So itching, irritation, there's some discharge and burning after urination or ejaculation. And for females, are more likely to develop symptoms. But if they do have symptoms, they experience dysuria. So that's, again, that pain during urination. All of this, itching, burning, redness, and soreness of the genitals. And the discharge from trichomoniasis is going to be typically a green discharge. So it's a distinct kind of vaginal discharge. And I think that's it. So you can treat it with oral medication. This is our guy that we saw in lab, Trichomonas vaginalis. You can see the flagella coming off of him like that. And then you can see the bacterial cells around this Trichomonas. So you can see how small the bacteria are compared to our protozoan. All right, so our two other disease-causing guys, trichomoniasis is going to be our protozoan, and then our Candida albicans is going to be the yeast. And we're done.